So good morning, and I want to first of all say thank you to the organizers for the opportunity to be here, and I'm really looking forward to this panel. I come to this out of personal interest. After the 2004 election, I really wanted to get more involved, and so I started exploring ways that I could contribute, and I started out registering voters. I became a voter registration captain for my county leading up to the 2008 election. And then I shifted to doing election protection work, which I still volunteer for. And then when I was in law school, I also started supporting efforts to restore voting rights to people with felony convictions. And then I continue now to do pro bono with the community law program here in St. Petersburg, Florida, which runs an Amendment 4 clinic to assist people with voting rights, driver's license suspensions, and sealing and expunction of records. So for me, I come at this personally. My ancestors did not have the right to vote, and so many people that came before me sacrificed so that I could have that right. And so I feel like it's important for me to continue to protect the vote and to encourage others to engage. So that's why I'm also super excited to be part of the Healthy Democracy, Healthy People initiative, which is a nonpartisan coalition of public health organizations working to advance health equity by ensuring that everyone has access to the ballot. And this is a placeholder for our website. So if you go to hdhp.us, you'll see this, minus my name and title, or healthydemocracyhealthypeople.org. And you'll see this, and we're going to be going live relatively soon. So next slide. So one question might be like, why are all these public health organizations interested in civic engagement? Well, you heard some of that from the fireside chat, but we know that voting shapes who gets elected, what laws get enacted, and that these things shape the conditions in which we live, work, play, and learn. And those are social determinants of health, but political determinants of health as well. And we also know that when people vote and participate civically in other ways like volunteering, which you also heard about, that there are so many individual and community health benefits. So we have set out to basically create this health and democracy scorecard as a way to help illustrate the connections between civic engagement, voting, and health outcomes. Next slide. At the start of this project, we conducted a literature review, and we looked at the evidence base for health and health-related indicators that are associated with voting specifically or civic engagement generally. And I want to make sure I recognize Jed Amurao, who is a master's student at UNC Gilling School of Global Public Health, who has been assisting me on this project. And I like to include this question in the middle, which is, in general, would you say your health is fair, poor, fair, good, very good, or excellent? This is self-rated health, and there are variations of this question, but I like to include it because it's one of the most frequently studied connections between voting, with voting, so self-rated health and voting. And there are other indicators that are associated with voting that are on the list at the bottom here. And we started out by looking at state level data for the selected indicators that you're about to see, and then ways to connect them to voting. So next slide. In addition to looking at voting metrics like registration and turnout, we also looked at indices that assess different aspects of elections. And the cost of voting index is one that we looked at that was first developed in 2016, looking at presidential election cycles from 1996 to 2016. And it was recently updated in 2020. And you can see an excerpt here showing the states ranked by their cost of voting index scores. These articles are available in the Election Law Journal. The reference for this particular one is on this slide. And importantly, this index measures the relative restrictiveness of each state's voting or electoral environment. And it's developed using what they call a principal component analysis that looks at 9 issue areas related to 2 very important things: registering to vote and then casting a vote. So then we wanted to look at how do we combine all of this information. So next slide is, as we were conducting this research, we also held 2 stakeholder meetings with representatives from public health, elections, and the intersections of those groups to help us identify what indicators we should focus on. And so as a result of our research and these meetings, we have included the indicators you see here on this next slide. So what we did was we pulled the data for the indicators, and then we sorted the data by the cost of voting index. And, I don't know how many people who are watching right now who are data nerds, but I am, and I was just so stoked when I saw this play out when we sorted the data that, on average, states that have the least restrictive electoral environments have across the board better individual and community outcomes than the US average. And the reverse is also true. So states with the most restrictive electoral environments have the worst outcomes. So on the first slide, the previous slide was voter turnout. We'll also be including voter registration, self-rated health and mental health, disability, and uninsured rate. And on the next slide, just an extension of this, we included active physicians per 100,000 population as a measure of health access. We included chronic disease prevalence, premature mortality and infant mortality, and poverty. And we also will be including a community and family safety ranking, which is not shown here. And I will just say a couple of things. One is these are averages, so of course there are exceptions, but you will also, when this website is live, you'll be able to actually see on the website data for each state. And I think it's just really astounding to see the correlation here. And we also plan to include data by race, ethnicity, and other factors. So next slide. So what's next? This is my last slide. We are finalizing data analysis, narrative development, and website design. We have partnered with the Center for Civic Design to host focus groups on our website development. And these images here are just some early mock-ups of what it might look like. So if you're interested, my email's on this last slide. Feel free to reach out and let me know, and I can connect you with the person who's helping us from the Center for Civic Design to run those focus groups. We do expect to launch at the end of the month, and we really want the website to serve as another tool in the toolbox for communities and organizations to engage in advocacy and to take a data-informed action approach. So please check out the website. One of the sessions this afternoon, you can hear more about the Healthy Democracy, Healthy People initiative with Jean Ayers, who's leading the charge on this initiative. And I want to just make sure I recognize, in addition to Jean Ayers, Jessica Barbara Brown, and our whole team that's working on this project to stand this website up in just a few short weeks. So thank you, and I look forward to the discussion.